couldn't go more than 4 hours without taking it. It was pretty much numbing me. Was arrested for breaking the law. Very hard thing to reach out and ask for help. It saves your life. It is saving people's lives every single day. It's just been amazing. Amazing. It started about age 36. I went to my doctor. I had shoulder pain, very severe shoulder pain. And I went to my doctor, and because of the pain, he prescribed a very strong narcotic to me. It was about a year in to taking the medication when I realized that I couldn't go more than 4 hours without taking it, and I would start feeling almost like I had the flu.
Addiction is a complicated brain disease in which the habitual use of very strong medications such as opiates actually leads to a rewiring of brain circuitry.
I also constantly had to increase how much I was taking in order for it to work sufficiently.
This rewiring, in fact, allows a disconnect between higher cortical brain functions such as reasoning, judgment, a sense of right and wrong, and allows the midbrain, a more primitive part of the brain, to essentially hijack brain behavior.
I put a lot of pressure on myself, and I think that the medication, as the more that I took, the more I realized that it was taking that away from me. It was pretty much numbing me to all the pressures.
So what do you think you sacrificed to maintain your addiction?
Everything. My husband, my children. I was constantly overdrawing my bank account, money to buy the medication, to see the doctor to get more medication. My life, basically. Everything in it that was happy, I was destroying. They say that people have to hit their bottom. My bottom was definitely being arrested. When I was arrested for breaking the law to get the medication, I started forging prescriptions, and I realized that at that point I had a problem, and I needed help. There's so much of shame connected to the things that you do when you're using, the things that I did when I was using, that I was ashamed to reach out. I was ashamed to say that I was an addict. I was ashamed of the things that I had done. And it was a very, very hard thing to reach out and ask for help. But I did it. Called Munson and got into their program, and it's the best thing that's happened to me. When I entered treatment, I was expected to be treated like this awful, horrible person that I thought I was. And I think learning that through the treatment and through my therapy sessions, that the things that I did are things that I did. They weren't who I am. And I was really feeling when I came in to the program, I was a shameful, horrible, rotten person for the things that I had done. I lost a lot of trust with my husband. My children are just now, after almost a year clean, are just getting their mother back. I was so numb. It didn't matter what they were doing and when they were doing it. It was, it's been a long road, getting back, getting the trust back, getting my children back to knowing Mom as the person that I was before the use. Unbelievable. I wake up every day so unbelievably grateful for Munson, for everything that I'm going through, for the Munson program, the aftercare program, my therapists, sobriety court, which I was sentenced to because of the crimes I had committed. It's held me accountable, but it saved my life. I don't know where I would be today without it. I know that I could not have saved myself. It's definitely, it takes a lot of support and a lot of people that care. The 12-step program that I'm in, that is the Munson program. There's an end to that. You know, you do your 8 weeks and you're done. The 12-step program is a forever thing, and working the steps and really figuring out what my defects are and what led me to this. And I realized they go all the way back to my childhood. I've learned a lot about myself and a lot about the tools that I need to stay clean. I pray every day. I learned how to not put so much pressure on myself. I learned how to not be so hard on myself. I learned how to control the anger. I learned how to be more patient, kind, and humble. The humility of all of this. The understanding that I have gained in not being so judgmental towards people. And I will have a year clean next month, and I've finally gotten there. I know of people that have done the same things that I did, people that are dying because of this. I know some that are dying right now, that are living in hotel rooms, taking every medication that they can get their hands on.
The very impulsive midbrain of the addict can lead to very aberrant behavior. These behaviors may include lying, stealing, promiscuity, various forms of fraud, any behavior that allows the midbrain to achieve its goal, which is to procure its desired drug.
And I know of many that have been stealing them from relatives, stealing them from sick grandparents. Doctor shopping is huge right now, as far as these people are going to all these different doctors' offices, but none of these doctors know.
Patients may falsely report their prescriptions have been stolen or lost, and frequently request an early refill. Some patients will attempt to call in prescriptions pretending to be a medical staff personnel, and some patients will even attempt prescription forgery.
I did it. I went from pharmacy to pharmacy to pharmacy. We've got to figure out a way to stop people from doing the things that I did before it gets so far that they're in jail. And if they don't reach out for help, they die. It's that simple.
Prescription drug abuse in northern Michigan is a real and growing problem, and it is imperative that providers become more aware of this problem and use the tools we have in place, such as maps, to try to curtail it. It is also imperative that the lines of communication between pharmacists, providers, and law enforcement are open and information is freely exchanged.
To the people out there that have this disease, the disease of addiction, the only thing that I can say is don't be ashamed to reach out for help. It saves your life. It is saving people's lives every single day. It's just been amazing. Amazing.